My name's Idrees, and I'm the lead dietitian for NHS Supply Chain. I appreciate that I'm just before lunch, so I'm going to try and keep it as tight as possible, but I think it's quite apt that we're talking about food, and lunch is coming up soon. But before I get into my presentation, my role is very unique in the sense that I get to go across the country, and I get to visit loads and loads of different hospitals, loads of different catering departments, and a common goal that unites everyone in this room, a common goal, and what every single hospital always tells me above everything is that they want to ensure that a patient gets a meal no matter what. And I think that is really commendable, that everything we've spoken about today, all the pressures that everybody is facing, every single catering department in this room, every single catering department in hospitals, make sure that that happens. And I think you should give everybody in this room recognition to each other and yourselves, because I think that's absolutely applaudable. And I'd like to give a round of applause to everyone in this room. It's absolutely fantastic. We try really, really hard to ensure that every patient gets a meal. On top of that, though, and as this has been touched upon earlier as well, there's this unavoidable reputation that hospital food has. And as it was mentioned earlier, obviously there's the Rate My Hospital plate, and hospital food is often a bit of an easy target. It's a bit of a punching bag for the NHS, unfortunately. And we're working so hard to change that, and every hospital who wants to ensure that there is a meal for every single patient is proud of the food that they serve. And it's a shame that there's this reputation that we just cannot escape no matter what. But food in hospitals goes further than only patients as well. We have a duty of care to give the opportunity to nourish the visitors who are coming into hospitals to visit the patients, their family, and their friends. And not only do we have a duty of care to give them the opportunity to have nourishment, but our amazing NHS staff as well. The caterers, yourselves, the porters, the nurses, the doctors. We have a duty of care to nourish them and give them the opportunity to have food at any point during the day. Because there's night shift workers as well, and that's a big push at the current time, that there needs to be an opportunity that everybody has access to food in hospitals at any point in time. And I appreciate, and again, like I said, I have the opportunity to go to every single hospital, not every single one, but a lot of different hospitals. You all have your very unique and diverse pressures. And driving sustainable change, i.e. driving change that you're able to achieve, is not going to be about me standing up here and say, right, these are 5 steps, and this is how every hospital is going to do it, and you're all going to achieve the most amazing thing in the world. You're going to transform your food service overnight. That's not what sustainable change is. And like I said, every hospital has their own internal and external barriers. They have their own way of food service, and therefore, you all have your unique diversities. But there are common goals that affect all of us as well. And we believe that in NHS Supply Chain, and I believe that in order to create sustainable change, the way to achieve that is to support each other across the food service in your hospital and to empower the individuals within the hospital to understand and want to make change as well. And therefore, to create sustainable change, we first need a culture and environment of understanding. As it's been touched on earlier, we don't have enough money. Oh, the board of exec aren't listening. Oh, this, that, and the next, right? But everybody needs to understand, and we need to start at that beginning of understanding. So the clinicians, we can, I'm a dietitian, we can complain, and we can demand that we need this in our hospitals, this is what we need to do, it's not meeting guidelines, it's not good enough. But if we don't understand the pressures that the catering department are facing, if we don't appreciate the diversity down there and why they're struggling or what understanding they need in order to make these changes, then we're just making demands that are non-starters. We're making demands that are unfortunately not achievable either. And the catering department as well, we need to understand why we're making those changes. It's not just, oh, it's another demand. Oh, it's not just another person saying, oh, we need to do this. But why do we need to make those changes? We need to empower each other to understand, okay, this is what we're hearing, this is what we need to do. And as you slowly build on that support, and as you slowly bring together that support from the individual, the clinicians, and that goes further than just the dietitians as well. It goes as far as the nurses who are involved in the food service, the doctors who may or may not be involved in the food service. And again, catering department, that includes hostesses, that includes anybody who's related in the food service. You start bringing these individuals together, and you help them to understand why we want to make this difference. You then have that empowerment to approach the board of exec, and realistically, without the board on board, without them on board, it's going to be difficult to stimulate that change. You know, you mentioned that earlier. How do we get them on board? It's about culturing that environment of understanding. And it's not just, we need this because this is what we've been told. But no, we hear that this is what needs to change. We understand this is why we need to change it. This is why we need to change it, and therefore this is how we're going to achieve it, because we've already had those discussions. And we've got everyone on board in order to make that happen. We've got the clinicians, we've got the catering department involved, and therefore this is why we would like this amount of money, or this is why we would like to see this change occur. And by doing that, you're bringing people along on the journey. It's not about just demanding, but it's about changing their hearts and minds and helping them to understand why we would like to make that change. But we can ask for all this change, and we can push for all this change, and we can achieve all this change. But if we aren't empowering the public as well, and that doesn't mean just the people externally, that doesn't just mean the media, but that also means like the staff in the hospitals as well. If we don't empower them to understand why we're making this change, then it's going to be a non-starter. So I go back to the retail areas in hospitals, and if you change the menu but no one's buying it because they don't like it, what change have we really made? Have we made that a sustainable change? No, because that's not what people want. However, if you make small steps in the right direction and you help the individuals to understand, they may go, okay, we may not like it, but we get why you're doing it, so we may give it a go. We're changing this because, oh, it's a seasonal vegetable, rather than getting one that's constantly available. We're choosing to change this because actually it gives you the opportunity to nourish yourselves. And by getting the public on board as well, you're able to achieve that. And again, in your retail space, you're more likely to make it a viable option. It's not just making change for the sake of making change, but it's making change that's viable, commercial, and understanding why that change needs to be made as well. But ultimately, today, we're all part of the catering departments, or to an extent, we're linked into the catering departments. We're going to be the backbone. The catering team is going to be the backbone of practically what's going to make that change. And I appreciate that staffing is a big issue, and as much as I would love to say, oh, I can give every hospital here, I can give every hospital 100 staff, that will sort all your problems, no. It's an issue that is a common issue that faces everyone. So what do we do around the catering team that we have? We empower them. So who is that food for? And as Nick and Michael earlier touched on as well, it could be for a child who doesn't want to be in hospital. It could be for a child who's been prodded, who's had exams, who's not had the opportunity to have food. They wake up at 2 o'clock in the morning and they are desperate for food. It's not just a patient, but it is an individual. It could be for a parent of that child who hasn't had the chance to even think about themselves because they are absolutely worried sick about their child in hospital. And they haven't had a chance to eat, and we recognize that they haven't had that. And so we say, this food is for you. This is your opportunity to have a bit of nourishment. This is your opportunity to take care of yourself. And we detail that to our staff so that they can understand that it's no longer just, oh, it's a patient. It's no longer, oh, it's a visitor. It's no longer, oh, it's a staff member. No, it's a staff member. It's a nurse who has done a 12-hour shift, who has been covered in God knows what bodily fluids, and who knows what sort of things have happened to their patients and their staff. They may have had a terrible day. And you've got the opportunity to cultivate an environment where they can nourish themselves, they can talk to a colleague or take a moment of reflection over an enjoyable plate of food. That's who the food is for. It's not just for people, it's for individuals. And then you take it one step further. So as you continue this journey of empowerment, you detail to the catering team, why is the food important? Yes, the food is feeding patients. We get that. But again, you take it that one step further. take a nourishing soup. It's high calorie, it's high protein. We take a meal that has got those additional calories to help on that recovery process for a patient who has those increased nutritional needs. It directly impacts on their recovery. And unfortunately, food often is reduced to little oral nutritional supplements, these liquids in a bottle, when we've got a whole team who are trying and working towards, who right at the beginning try to ensure that there is food that is there available for every single patient in hospitals. So we need to help them recognize why the food is so important. They are just as important as the clinical staff on wards as well, because that food directly aids their recovery. But again, it goes one step further as well. It's not just patients in hospitals. So flipping it on its head, if you're a staff member in a hospital, and appreciating the cost of living, this may not be the most, ideal situation, but if you're a staff member in a hospital and you eat a meal every day in your hospital, you eat your lunch every day in the hospital 5 days a week, that's almost a third of your meals in hospital. That's almost a third of your meals that you're getting from your provider. So therefore, what are we doing to directly impact on their health? Are we directly impacting it positively, a third of their meals, or are we directly impacting that negatively? And everybody becomes a patient. So are we helping them along that process to delay the opportunity of them to become a patient, or are we directly impacting on them and then we reduce their chance of recovery later on down the line? Are we helping them to be healthier? Are we helping them to achieve wellness? Or are we saying, you know what, we're just giving you a meal and that's the end of it, right? So again, it's helping the catering team understand exactly why the food is so important. I mean, earlier today I said, we've got lunch straight after my lecture, and I know that's on my mind, and it's probably on everybody's mind as well. But it's something to talk about. It's something to get excited about. And when I used to go into the hospital in the morning, we would look at the menu and be like, oh, this is really exciting. This is what I want to kind of look forward to during the day. And you're able to cultivate that in hospitals. You're able to cultivate that as a catering team. What are we doing to get people excited about the food that we're serving? What are we doing to say, okay, actually, you know, this is the chance to really enjoy. We see someone eating a lovely plate of food. We go, where did you get that? Oh, it's actually the restaurant that we ate in. It gives the chance for the patient in a hospital bed to have something to look forward to, a hot, enjoyable, and nutritious meal, provided it meets their requirements. And as you build on this empowerment, as you help the catering team to understand and recognize their importance, how important it is to cultivate all of these things, how important they are to meet this, to meet requirements, to be brought along this journey, and you help the clinicians and you help everybody else in the hospital understand their importance as well, so that they are able to demand a little bit more, so that you culture that environment of understanding. And people are not just, oh, it's another demand. Oh, it's just another thing that we need to give to the catering department. No, we get why they're asking for that. And it helps to reinvigorate their passion. Because, like Nick said earlier, no one goes into hospital, no chef goes in and says, oh, I'm going to do a bad job today, right? But it's easy that if you've been doing the same meals, the same process, the same thing, day in and day out, you can get a bit stagnated. You don't necessarily get excited about what you're doing, but through the process of empowering our catering team, through the process of helping them recognize their own importance and giving them the opportunity to be part of that, it can help reinvigorate their passion. And you give them the chance to do more, and you give them the opportunity to learn more, understand more, and be that person who wants to make that change. And the more that they would like to make the change, the more that you would like to make that change, the more you get the clinicians who understand that they would also help you to make that change as well. Then you're able to bring all those layers together and create sustainable change. And NHS supply chain is here. I'm here today, and we're here today to support you on that journey as well. Because, like I said, it's all well and good me talking about this and saying, right, we need to make everybody understand, but then practically what can you do to make that difference as well, right? I'm not going to give you information and then run off. No, there's that next step, there's that follow through. And we believe to be able to help you and to be able to create change one step at a time in a sustainable way so it's able to occur day in, day out, so no matter if that staff member leaves or if that passionate person leaves, then they're able to continue that process. We eliminate as many barriers as possible. So, Idrees, I would like to change the menus in our hospital. Fantastic. Already, NHS supply chain has over 200 recipes that are already nutritionally analyzed. So if you don't have a dietetic department, or the dietitians don't have the capacity to make change, they are there. We have removed that barrier for you. So they can either say, oh, this addition needs to happen, or we need to change these macros slightly, and then that meal is fine. Not only do we have these recipes, but there's the NHS bank of recipes as well that I believe has been soft launched. And these recipes from ourselves and from NHS are not designed, like I said, like Nick said, with 20 ingredients and 80 different steps. No, they're from food that's available. They're from food that is approachable, and they are made for NHS hospitals. I would like to start a nutrition hydration steering group. Brilliant. What are your priorities? Have you got the people who need to be on board, or do we need to take it a step back and find out who the passionate individuals are who are able to make a change? Do we need to help them understand why a nutrition hydration steering group is important? Would you like NHS supply chain, myself, or the chefs to come along and talk to the key stakeholders to help you push that agenda for change, help you push that environment of understanding? I want to empower my staff. The theme of today, the theme of I can't give you 100 different staff, but I want to give the staff the skills to be able to achieve more, the understanding to achieve more. Bring them along to our Chefs Academy. So the chefs can come along to the Chefs Academies where they learn skills, they learn basic, simple nutrition knowledge to help them understand and start setting that scene. We have the Skills Academy for the massive groups of catering assistants, and we teach them simple skills, basic skills, because you may not be a scratch-cooked kitchen. We understand that. But what else can we do? What else can we do to achieve what you would like to achieve? Culinary engagement days where we come into your hospital, where we help to push that agenda for change. We get people on board. We say, we are hearing what you're doing, and we want to help. And therefore, we want to demonstrate that change works, proving that it is commercially viable. So we'll come in and support you on that journey. We'll come in and help develop and make new recipes that fit in your food service. Not, okay, this is the recipe everyone's going to use. No, we come in, we understand how and what you need to achieve. Do we need to shift things around? Can you think differently? And challenging that status quo that was touched on earlier. And we adapt on your demographic. But more so than that, we're constantly striving to improve. Are we looking to reduce your waste? Are we looking to reduce your carbon footprint? Are we looking to, okay, we're not going to eliminate this recipe. You know, if I go to the north and I say, right, no one can have corned beef hash anymore because it's not sustainable, I'll get laughed straight out of the kitchen. I'll get laughed straight out of the hospital because that's what they want. But what small steps can we do to make a difference? Okay, you got a shepherd's pie. Let's put in 30% of a vegetable product or 30% of a meat-free alternative. Doesn't have to be all the way, but it's small steps to make those changes. And that is, ideally, how we would like to cultivate an environment of sustainable change. And it's small steps one at a time, and there is support out there to help you achieve that. We're not saying this is what you need to do. We're not saying, okay, here's all the information, figure it out yourselves. The support is there. I'm here to help you achieve that, whether it's dietetically, whether it's for the clinicians, whether it's the board of exec, whether it's practically from our culinary staff as well. We're here to help you achieve that one step at a time and to make sustainable change.